Hello everyone, welcome to Coffee with Frosty's multiple myeloma series. Today we're going to talk about chemo day, helpful hints, what to bring, and how to prepare. Before we even get into it, if this is your first day having treatment, you probably want to bring somebody with you or have a driver because you don't know how the medication might affect you. So that will be very, very helpful. Now, if you bring somebody with you, it doesn't necessarily mean that they can sit with you while you're having treatment. However, they can at least be there in the waiting room or, drop you off and pick you up, and that is also very helpful. Now, sometimes when you go, even if all you're getting is a shot and you have to go into the infusion suite to get a shot, sometimes just going to the doctor's office usually entails blood work in the beginning. Sometimes you'll have to see the doctor, sometimes you won't. And then you'll have to go back and wait for your treatment, even if it's just a shot. Sometimes this can take a very long time. I've been at the doctor up to 2 hours sometimes just having blood work drawn and getting a shot. So it's a very long afternoon sometimes or morning, whenever you go. But also if you're going in for, a standard infusion that might take up to 4 hours or so, it's a long day for you. So you want to have some things to help you through and to keep you comfortable and to keep your mind occupied. Some things that are helpful to do is to bring something with you that you can read, something that you can write. It's a good time to write some letters. Bring some stationery, some notepads. If you like to read, bring some books and magazines. If you draw, maybe bring some art pads. I do see a lot of people that like to do crafts, so they'll bring their knitting with them, make their, they make blankets or, different sewing projects. There's quite a few people that like to do that. Some people just like to sit and listen to music or watch a video, and if you do that, I would suggest, bring your headphones so that you're not interrupting the people around you, but then you can listen to the music, you can watch a video. And also, if you don't feel like having conversations with others that day, having headphones just kind of allows you to have some quiet time. So if you just want to keep some music on and stick to yourself, that's a good way to do it. Then you always want to have a bottle of water with you or, whatever you like to drink. And some tiny little bite-sized snacks, gum or just something small that you can eat to help you maybe not be so nauseous or, to keep you going if you haven't been able to eat that day. And then always, sometimes it's cold in there, so you might want to have a sweater with you or a very light blanket to keep yourself warm. Now, when you're at home, you know how else to prepare before you go. Especially if it's your first time going and you don't know how the medication is going to affect you. It's always nice to come home to a clean home with your laundry done, your chores are done, and you want to have some meals that you've made in advance. That way you don't have to worry about cooking, especially if you're cooking for a family. It's nice to have these things done in advance. Or maybe have a slow cook recipe that you can do that won't require a lot of energy that day because you might not feel like cooking. It's also very helpful to have some drinks and some snacks handy, some little bite-sized snacks in case just in case it's not easy for you to eat for a day or two. Sometimes just having little bite-sized snacks handy gets you through and is very helpful. And of course, you always want to have a good supply of your water, your tea, coffee, colas, whatever it is that you are able to drink and enjoy, and make sure you have those handy. When you go into the infusion suite, you go into the doctor's office, just as a common courtesy, always just be nice. Some people that you'll see, if you've never been and this is your first time, Some people that you see are very, very ill. Some of them have very advanced diseases. Some are newly diagnosed and they're very afraid. Some people are just naturally shy, don't like to talk. Some people are just plain rude. You can't get around that. And, sometimes the staff, they're not trying to be rude to you, but maybe they're overworked, they're very tired. They have lives at home as well, so maybe there's something going on that you don't know. Just always be nice. Smile, makes you feel better, Try to stay positive and smile and be friendly and say hello and, read the room, basically. So, just be nice and treat people the way that you would like to be treated is probably the best advice. As always, I am not a medical professional. I'm just here sharing my own personal experiences and giving some advice along the way that I've found. All right, thanks so much, everybody. Have a wonderful day, and don't forget, always find a sign. Take care.